Okay, the flu vaccine cannot give you the flu. Okay, so it is a killed vaccine. It is not possible to get an active influenza viral infection from the flu shot. So that's the first misnomer. Now, some people do feel a little at odds after they get the vaccine. So it is possible that you get a little bit of immunologic response, a little bit of inflammatory response, you get a little achy, maybe even some low-grade fever, but that is so mild compared to getting a full-blown case of the flu that, you know, that's something that I put up with easily, knowing that what I'm going to prevent potentially down the road. Unfortunately, there is some misinformation out there, and there are some thoughts that people have that you know, somehow this is unnatural or that the vaccine isn't safe. I would just be so stringent in trying to dissuade people of that. That you know, this is a vaccine that we make every year. We have a really long track record of safety and efficacy in testing, and that this is something that people really should get. You know, to protect themselves, to protect their families, to protect other people who are at higher risk of complications of flu. So every year we think that you know, somewhere in the neighborhood of 20,000 or more people lose their lives in the United States due to influenza and its complications. The best way to prevent that is through getting the vaccine. And if you get the vaccine and you're not in one of those high-risk groups, you might be protecting family members, other members within society. And in addition, it helps to prevent the complications of flu. So a lot of people don't really put that in the mix, that even though they're not going to die from influenza because they're young and healthy, they're very prone to be getting bronchitis after flu, or sinusitis, or some other complication of influenza, or a complication of the treatment of those complications. So it gets kind of complex. So, you know, you come in after you've had the flu, you've got a case of sinusitis now. Your doctor puts you on antibiotics. Now you have an allergic reaction to the antibiotic, or you develop colitis or some other complication of the antibiotic. So it's kind of a snowball effect. All these things can be prevented by getting that flu shot.